This is Hester Vaughan from Lifestyle Coach. I'm going to do the presentation for the update evening that I did last week with all the new updates and enhancements for Discovery Health and Vitality for 2016. If you have any questions, you can email me on hester@lifestylecoach.co.za. Right, so I'm going to do it in two sessions. The first one will be on the changes to Discovery Health, and the second clip will be the changes on Discovery Vitality. Okay, so these are the main things that we're going to be discussing. You can have a quick read through if you can, but I'm just quickly going to shoot through it. Right, so there's an 8.6% increase across all the plans. I'm not going to tell you why. Sure, there's all the usual reasons, but it's 8.6% increase. Okay, and as per usual, when there's an increase, then all the other things increase. Besides your premiums, your amount of savings will increase, your co-payments will increase by 8.6%. So the only thing that is not like that, I just wanted to bring your attention to it, is the oncology threshold. There's no change to this, and this has been of interest to me. I've asked them the question a few times, and apparently 98% of people who are claiming oncology benefits this year did not need any more than the current allocation, which is 200,000 Rand for any of the lower plans, the coastal, the essential, and the classic plans. There's 200,000 Rand allocation. Thereafter, unlimited, but with a 20% co-payment. For those of you with gap cover, you can email me afterwards. Certain gap covers will pay that 20% co-payment, so you pretty much have got unlimited oncology cover anyway. And then on the classic comprehensive plans, all the executive and the higher end plans on Discovery, your allocation is 400,000 Rand. So the reason why they say they haven't changed it is because, as I said, 98% of people don't go over that threshold, and also it's a rolling year. So, for example, if you get diagnosed with cancer in June of 1 year, your 12-month year will go until June the following year. So you'll have 200,000 Rand to spend within that year, and a lot of people in that instance will choose to upgrade at the end of the year, because remember the golden rule: you can upgrade only once a year at the end of the year, but you can downgrade at any time during the year. So they choose to upgrade to one of the higher plans, and then they have got access to the 400,000. So that's the reason why that hasn't changed, and that is it. Right. For those of you who are on Key Care, which is the lower income plan that is subsidized by all the other members, what's changed is instead of 1 out-of-network visits per year, you now get 4 out-of-network, because as a Key Care person you get to choose 2 GPs and you can only go to those ones. And then this is quite funny, the doctors have actually requested this because it's unlimited GP cover on the Key Care plan, but they were finding that certain patients were going really often, and so they have requested that on the 15th GP visit for that year you have to get pre-authorization from Discovery. And then the one thing that has gone down slightly on Key Care Health is that your shoulder and knee replacements or operations, it's only for P&B. So I'll quickly explain that. So for Key Care, what I like to say is they only really, they don't cover wear and tear operations. So if you need a hip replacement or a knee replacement, or your shoulder's been out so many times that you now need to have a shoulder op, that is not covered under Key Care. It's really just your life-threatening and limb-threatening operations, which is, for example, if you are in a car accident and your knee is shattered and they need to replace your knee, then it is covered. So that's what's called PMB, prescribed minimum benefits. That is anything that's life-threatening or limb-threatening. Those are covered. Right, that's all the changes on the Key Care. So the main thing, that's the whole purpose of this talk, is the new option that Discovery have launched this year for next year, and it's called the Smart Plan. So it's a completely different option. A lot of people are a bit scared of it because it's very technologically based. But I think there's definitely a place for it. It is a plan that is basically seen as a core plan, so there's no savings. The difference is that you have got unlimited GP visits. So the thing is that they're not going to release the names of which GPs are on this list. So this is not for you if you have got a long-standing relationship with your local GP and that's the only guy that you want to go and see. This is, and coincidentally, they said there were so many people on Discovery Health that actually go to 4 or more different GPs during the year. So that's where this plan has come from. So basically, you have to have a smartphone to be on to be onto this option, to go onto this option. It's going to be an app. And we think this is the way that medical aid is going. So this is the prototype. So the good news is if you decide to go onto this option for next year and you decide after a month or two it's not for you, there's a 90-day cooling off period. So this is the only plan that you would be able to upgrade from or downgrade in the middle of the year. So it's a 200% cover plan. So whereas the coastal plans and the essential plans covers you at 100% in hospital, this plan will cover you at 200%. You're going to work the whole thing on your app. You'll go onto the phone. You will say that you need to see a doctor. So you've got 2 options. You can get a video call GP consultation, which is for free. And the GP, you can actually say, Doc, can you tell me what this rash is? And the doctor will tell you whether you need to come in or whether he can prescribe a cream, or I'm just kidding, but that's what it is. You've got video call GP consultations right through the night. So that's really great if you've got a sick child and you're very, very concerned and you need to know, should you take this child through to the emergency rooms? Or you can say that you want to actually have a GP visit, face-to-face visit. Unlimited GP consultations. They guarantee that there will always be a GP within a 5-kilometer radius of where you live. There's a 50 Rand co-payment. So though they can't give us a list of who these GPs are, I surmise that they will be your higher end, or should I say the very techie savvy GPs, because they're only going to use GPs who are using the iPad rollout, the launch that Discovery have done over the last few years. They've given all GPs iPads, and they want them to use it so that they've put in your details and all of your medical history will come up, what medications you've used, what reactions you had to them. So that's how it will work with the GP consultations. Your medication is also covered, and there's a co-payment of 10 Rand per medicine item on the script. Just a note here, this is more for your sicky kind of medications. So it will be antibiotics or creams for rashes, as I don't have a rash, I keep mentioning that. It's not like contraceptives or Ritalin or the medication that you need for bad acne. It's not those kind of medications. It's really just if you are sick. It also, the other thing that's good about this plan is that it covers you for MRI and CT scan. So just a note, if you are on a core plan, you have no cover for MRI and CT scans, which confuses people often because they think that you have these scans done in hospital, but it's not covered unless you are already in hospital for like extreme pain, or they're not sure what's wrong and you've been admitted into hospital and you need an MRI and a CT scan. Those are covered then. But if you are on a core plan and something is wrong, you have a sore knee or a sore stomach, and you go to the doctor and you say, please can you find out what's wrong, and he sends you for a CT or an MRI scan, you have got no cover at all. If you are on the core plan, you have to pay for that yourself. So the good thing about this one is MRI and CT scans are covered, but with a co-payment. And again, I mentioned that the gap cover, certain gap covers will cover that co-payment for you. And the other thing that they cover is, it's not on this screen, but they cover you for the rehabilitation benefit, which is if you are in a very bad accident and the trigger is 4 nights in ICU, they will pay for up to 2 years for your rehabilitation, which is a very good benefit. So as I said, it will be a doctor near you. You make a real-time booking. You can either have the video consultation or you actually go and see the GP, and then you get to rate the GP. So for those of you who've been on Uber and you get to rate your Uber driver. Right, and okay, this is the other big thing about the smart plan. I'm not sure if you can see it on the screen, but it's got a list of network hospitals. So for Cape Town, the hospitals are Panorama, Constantiaberg, Gatesville, Cape Town, Stellenbosch, Mitchells Plain, and Milnerton. Those are all the Mediclinics. For KwaZulu-Natal, it's Mediclinic Pietermaritzburg, Netcare St. Augustine's Hospital, JMH Isipingo Clinic, Life Westville, and Netcare Umhlanga Hospital. Eastern Cape, it's Netcare Green Acres. And Gauteng, there's a lot. Morningside, the Donald Gordon, the Netcare Clinton. I'm not going to read them all. You can actually go online and just Google Smart Plan Hospital Network and see which ones are on. So that is the other thing. So just in a nutshell again, This is a plan that I think is good for maybe young families with children that are at the age that just need to see the GP a lot. This would be a good plan for you. Again, it's not a plan if you are a bit technologically nervous and if you have got a long-standing relationship with your GP. Right, so that's that about the SMART plan. This is just about exactly the same maternity benefits. So that's exactly that. I just wanted to stress that as well. It's exactly the same hospitalization cover as any of the other plans. Chronic medication, same cover for chronic. Just wanted to mention again that these are the service providers, the designated service providers for Discovery for your chronic medication. Dis-Chem, Clicks, and again, it's not every single Dis-Chem and Clicks. You have to ask them if they are a Discovery service provider. Some of the smaller ones aren't. And then Discovery Med Express. If you don't go there, you will have to pay a 20% co-payments. And then just a note, if you suffer from diabetes, hypertension, or high cholesterol on any of the plans, Discovery have got personal health programs to help you manage these conditions and give you discounts on the medication that you need and the food that you can eat to help you, and any of the little strips and glucose testing and all of that stuff. So if you have got those, phone Discovery and ask them about the programs and they will explain them to you. Right, acute medicine, as I explained, you have to go to Dis-Chem Clicks. You'll choose which one you go to, and once a year. So sorry, on the SMART plan, it's only Dis-Chem and Clicks that you can get your medication. You have to choose once a year, and then your prescription will be on your app, and you'll go and get it. And it's 12 scripts per year, and the medications are Schedule 3 and above. Right, I've already explained all of these to you. Okay, so the next thing that's new on Discovery is genetic testing. I'm not sure if you've heard anything about it, but it's something that you can do. It's very pricey. It's sort of between $700 and $800, I think, normally, and you can only have it done overseas. But basically, there's a test that you can do that will then tell you what you are likely to get as a disease in the future, where your weaknesses lie in your body. So Discovery have brought this out as a launch, in their launch, to say that it's available. And at first we were a bit concerned, but so the reason is, well, let's just put it this way. It's not for someone who is curious about how they are likely to die in the future, or somebody who's a hypochondriac. It's literally there to help Discovery and to help the doctors treat you. So there's a case, this is an example, there's an oncology drug which costs between 1.5 and 2 million rand per treatment, but its efficacy is only 20%. But if you do it in conjunction with this genetic testing, the efficacy is much, much better. So it is for people, as I said, who have had a prior diagnosis. So if you've already been diagnosed with something, with a serious illness, this testing will help your doctors to pinpoint how to treat you, and it will just aid your chances of getting better. It's also if you've got a very high risk, a family history. I know Angelina Jolie did this testing, or you have symptoms and they can't find out, the doctors can't find out what's wrong with you, then this genetic testing is for you. But if you have this testing done, in the future, if you ever want to get more life insurance or severe illness cover, the life insurance companies can ask for the results of these tests. So it's not a good idea to do just if you're curious. It really is just if you're in one of these brackets. Okay, and the other nice thing about it is if you have a high-risk pregnancy, if you're of the age where you have a high-risk pregnancy, it takes the place of the invasive, I don't know what they call it, but where they put a needle in to try and pull the, to get the tests for babies. This is a non-invasive way of doing that. Right, there's a new family history tool where you go online and you can just say what your family history is and you'll get more points for that. That's also new, and I think, all right, and that's one other thing that they've brought out, which I think is amazing for people who are in the advanced stages of cancer. Discovery have brought a whole palliative care program. So if you are at home and it's the final stages, there will be a doctor who is trained in palliative care who will design the whole program to help you look after your loved one. There will be a nurse who will come once a day to attend to wound care or pain relief, and then there's a home care carer who will come every day, who's not a nurse, but who will help you look after your loved one. Pretty much what hospice does, but very well organized by Discovery, and because they are your medical aid anyway, this is a fantastic thing that they've done. And that's it. The next one is the Vitality. Thank you.